We are on the verge of a long holiday weekend, and a lot of people are getting ready to head out, have some fun in the sun. Well, the American Cancer Society has designated today as Don't Fry Day, and we're about to find out why. Dr. Scot Ackerman is one of the first coast's leading oncologists. He joins us every Friday to talk about important health issues such as this. I think it's kind of self-explanatory. Don't Fry Day. I mean, we're talking about getting out in the sun, and I'm going to go on a limb here and say it's about not burning.
Right. It's not about French fries.
Okay. All right. Not about, yeah, all right.
That's actually, when I first saw it, that's what I thought. We're not going to fry chicken. We're not going to fry French fries. No, it's not about that at all. The American Cancer Society has designated today, the Friday before Memorial Day, as Don't Fry Day. And fry, this is to raise awareness of sun safety and encourage people to take steps to protect their skin from the sun. So don't fry your skin in the sun. So Don't Fry Day.
Yeah, because there are a lot of health repercussions from getting too much sun exposure. So let's talk about it from the expert, from our oncologist and our doctor extraordinaire. What are some of the things that we can do to stay safe in the sun? I mean, really, let's go beyond just put sunblock on and head out.
Well, you can do lots of things. So first of all, cover up. Sunblock is, cover up. But cover up is more than just sunblock. You can wear protective clothing. If you go outside with a shirt, if I wore this shirt outside, I wouldn't get hardly any protection from the sun. So regular clothing, regular shirts don't give you a lot of protection from the sun. It's really a false sense of security.
Yeah, see, I would not have known that. I would assume that because you're wearing that shirt, you're automatically protecting yourself.
You need to get clothing that has a UPF, ultraviolet protection factor, and a lot of the fishing shirts, not something like you're wearing today, Casey.
My giant Post-it note dress. There's no sun protection on this thing.
And probably stores that you may not frequent, but they do have sporting goods stores that have these UPF clothes, and these are really good. And actually, the great stuff you can wear. You go out to the beach. If it has UPF on it, that means it protects you from the sun. Also, wear a hat. To shade your neck and your face, because your neck and face get exposed to a lot of sun over the years. And I sadly see a lot of patients who have very bad skin cancers involving their ears and their nose and their face, and that's because of chronic exposure to the sun, not wearing a hat for many, many years. Also, sunglasses. Sunglasses have ultraviolet protection factor in them as well, and you can get small skin cancers right at the corners of the eyes if you don't use proper protection, and that can be very devastating. Avoid the sun when the rays are strongest, between 10 a.m. and 4 p.m. Another good idea, and sunscreen, as you mentioned. Slap that on. Put the sunscreen on.
Well, let's dive into that, because there's so many sunscreens that are out there. I mean, how do you know you're getting the right one? And SPF 30, 150. I mean, what is the difference? And do we have to keep reapplying it? I mean, what is the proper way to even use this stuff? I just keep spraying it every few hours. I don't even know if that really works.
Good. Well, that's what you should be doing.
Okay.
First of all, you want to use a sunscreen that has broad spectrum coverage, because you hear about the ultraviolet A rays or ultraviolet B rays. Some say that one is safer, one's not. The truth is they both can cause cancer, UVA and UVB. So you want to get a sunscreen that says broad spectrum on it to cover both, number one. Number two, get an SPF of 30 or higher. We used to recommend 15 or higher, but the truth is you need something that's 30 or higher. And SPF of 30 will block 90% of the sun's harmful rays. If it says waterproof, it's not. It may be waterproof, but it's not. You gotta put it on your skin. If you go in the water, it's gonna wash off. So all the sunscreens are only water resistant. They're not waterproof. So if you're in the water, reapply it. So what you're doing, spraying yourself multiple times, is good, because even if you sweat a little bit, that sunscreen is going to wash off your body. You're out in the sun, you're hot, you're going to sweat. So reapply it frequently so you maintain that proper protection. And as we've talked about here in the past, there's different components to sunscreens. Some of them are made with zinc oxide, and some of them are made with some other chemicals. And some of these chemicals actually may do more harm than good. The ones that have oxybenzones in them and that sort of thing, they can actually cause cancer. So look for the natural sunscreens, and zinc oxide is something to see on them. So try to get the natural sunscreens.
This is something that I know that we did way back in the day when I was growing up. We grew up in Ohio, and I knew we were getting ready to go on vacation, and so we would go to these tanning booths. And now a lot of controversy surrounding them, but we would go and get base tans, thinking that if we had a good base tan, that we wouldn't burn if we went to Florida. We were coming from Ohio, it was during the winter. So is that a good idea? I mean, looking back on it, getting those base tans, does that even help you? Well,
the truth is that you're still going to burn, because those base tans are only going to be one kind of ultraviolet rays. There's other ultraviolet rays, and you're still going to burn. And also, you have this false sense of security that you're not going to burn. You're going to wind up staying out in the sun longer and have more risk and also burn. And also, don't forget, tanning beds increase your cancer risk, especially the risk of melanoma. If you use tanning beds, you have a 74% increased risk of developing deadly melanoma.
Is that just if you have more of a likelihood of burning? Like, you know, I know I have a friend who's a redhead who she walks outside and she burns. I mean, she obviously doesn't go to a tanning bed, but if you, like, you know, I don't burn as much, is my risk of getting skin cancer going into a tanning bed as great as hers? I mean, is that how dangerous a tanning bed can be?
The tanning bed, that in and of itself increases your risk of melanoma. It's not going into the sun afterwards, and your risk is the same as hers.
Yeah, wow.
So be safe this weekend. Try to
Lots of
implement
sunblock.
these tips, keep you and your family healthy.
I'm going to go get it. I'm going to go change my outfit right after this. Thanks so much, Dr. Ackerman. I appreciate for being here, and thank you so much for sponsoring the segment as he comes on every Friday to give us important health information. And if you have any questions regarding today's topic or any other health questions that you may have, you can visit Dr. Ackerman's Facebook page, which is simply facebook.com/First Coast Oncology.